Okay, so let's continue. Um, Welcome to part 2 ng COVID vaccine update version 2.0. So this is just a summary. This is just a summary table showing the efficacy and the estimated cost of currently available COVID-19 vaccines para lang mas madali natin makompare ang iba't ibang bakuna na available na so far. So yung merong blue check with parenthesis are the ones with pending application for FDA approval sa Pinas. Then yung merong red check is yung na-approve na. And then J&J and Sinovac, they have been approved for phase 3 clinical trials sa Pinas. There's actually another one, yung Clover vaccine, but I decided not to include it here kasi wala akong masyadong information other than it's a subunit vaccine na may trimeric glycospike protein with a CpG adjuvant. Again, technical. Hindi natin alam masyado. Huwag na natin munang pag-usapan para hindi magulo. So, in terms of overall efficacy, the modified mRNA vaccines ang pinakawagi sa pag-protect against symptomatic COVID-19 at about 95%. Then the rest basically have either high to moderate efficacy. One important thing to note though, and I've been emphasizing this every time na nag-discuss ako about vaccines, is that all protection are above the 50% threshold of protection required for FDA approval. And again, partial protection is always better than zero protection. One important thing to note is that during the phase 3 interim clinical trial, yung naging focus ng basis of efficacy ng bakuna is prevention of symptomatic disease, symptomatic COVID-19 disease. And even this symptomatic disease were defined differently in clinical trials. Kaya minsan, ang hirap i-compare yung mga bakuna kasi iba-iba yung study design nila, iba-iba yung trial design nila. In most of the trials, for the symptomatic, this included mild, moderate, and severe infection. But for vaccines like Novavax and Johnson & Johnson, I believe they only counted the moderate to severe COVID-19 manifestations. Kaya, yun, something to remember lang. Para kung nagko-compare kayo ng mga bakuna, yung iba, yung binilang nila is from mild to severe. Yung iba naman is from moderate to severe. So naturally, if you only count moderate to severe, you would expect higher percentage. But then again, what really is significant or not, you don't really know. But I mean, point is, they're all protective enough. Okay, so for Novavax and Johnson & Johnson, as I've said, wala pang paper tong dalawa na to, so I really can't check the details. But as I've said, engaging the efficacy, it is important to be aware kung ano exactly yung binilang nila. So it's the moderate to severe COVID-19 disease. But yun na nga, the good news is it appears that all the available vaccines have very high protection. If you only just consider lang natin our severe cases ng COVID, the severe form of the COVID disease, they all have very high protection. Actually, many have 100, or many claims to have 100% protection. And why is this important? Because bukod sa maiiwasan natin yung possible death, kung mapaprevent natin yung severe na COVID disease, most likely, hindi na rin natin kailangang magpa-ospital pag napakunahan tayo ng mga bakuna na to na merong very high protection against severe COVID disease. And considering na mahal ang gastos na pwedeng aabutin pag nagpa-hospital tayo sa COVID, malaki-laki rin yung matitipid natin personally at ng PhilHealth kung magpapabakuna tayo. Another data that I want to highlight in this table is the estimated efficacy after single dose vaccination. So it's the blue ones right here and the one in Johnson & Johnson kasi single shot lang talaga siya. So dahil nga sabi ko nga dahil nga merong shortage ng bakuna ngayon sa mundo, meron actually plan B na sinasuggest yung ibang experts ngayon na just in case meron talagang vaccine shortage, the plan is just to temporarily vaccinate as many individuals as possible with just a single shot. Now, except for Johnson & Johnson, where they intended their vaccine to be administered as a single shot naman talaga, and their efficacy ranged from 57 to 77% protection against moderate to severe COVID-19. The other COVID vaccines were designed to have at least 2 shots for optimal protection. So, worst comes to worst, kahit papano, if you look at the blue data here, meron tayong kahit papanong konting idea kung ano yung level of protection na pwedeng ma-provide ng ibang bakuna after just the first vaccination. For Astra, they claimed that a single standard dose provided 64.1% against symptomatic COVID, which is not bad. Pfizer claimed about 52 to 90% protection, although I believe the 90% protection is mainly anecdotal. So, well, it's still good. And then Gamaleya also claimed 73.6 protection against severe COVID after the first shot. So, carry na rin. Pero, even with all this data, meron pa rin actually importanteng data na unfortunately hindi kasama sa maraming phase 3 interim results. Specifically, wala pang masyadong information if, in addition to preventing symptomatic COVID-19 or preventing the manifestation of the disease, hindi natin alam kung ma-prevent din ng mga bakuna na to yung mismong transmission or pagkalat ng virus. And this has important implication sa pagdating sa magiging possible role nito sa pag-emerge ng mga bagong variants in the future. And we will talk more about this later. Anyway, so far, Astra is the only study na merong information about protection from asymptomatic infection, which is actually not as high as we want it to be, pero meron kahit papano, especially sa low-dose, standard-dose scheme nila. If the Pfizer vaccine trial in Israel is to be believed, or yung claim that some claimed about 33% protection from asymptomatic infection even just after the first dose of vaccination. But again, this is a claim without any data available for scrutiny. So, parang chismis pa lang to at this point. But, I mean, it's an estimate. When it comes to cost naman, the vaccine price varies significantly from each other. But complete regimen of the vaccine can range from about, let's just say, $12 to $66, so around 600 to 3,300 pesos. With AstraZeneca, Johnson and Johnson, and Gamaleya being the cheapest among the vaccine choices. Novavax, Sinovac, and Pfizer ay medyo mid-range. And then yung Sinopharm and Moderna, yung relatively the more expensive ones. But please note that many of these cost estimates were based on their published market price during the development process. And yung final price ng mga government natin actually would depend on other factors during their price negotiation. Normally, developing countries like the Philippines will get a discount sa cost from some companies like Astra, who initially indicated that they will be selling their vaccine at cost or no profit at least early during the development, kaya sobrang mura nila. Kasi nga supposedly wala silang tubo sa pag-develop ng vaccine na to, because this is a project that was conducted in collaboration with Oxford University. So para talaga to sana naman talaga, yung main goal nito is to help the poorer countries na maka-afford ng bakuna against COVID-19. But with the current shortage and pressure from different governments, honestly, hindi ko na alam kung ano yung magiging presyuhan ng AstraZeneca na to, and maybe the company is also wants to I guess have some profit. So I guess malalaman natin kung magkano talaga yung final na presyo once we have the COVID vaccine na. The Astra COVID vaccine. Some countries can also get discount from various companies if you allow them to conduct vaccine trials in your country. And this is actually just a normal quid pro quo na arrangement for many vaccine trials. So there's really nothing weird about this one. This is done not just for COVID. Normally, if you volunteer if your country is a trial participant, you usually get a discount kasi nga gagawin kayong guinea pigs, diba? And as I've said, huwag masyado magpanik pag sinabi ko. I know I should stop calling trial participants guinea pigs kasi parang merong negative na connotation, but I hope you don't take that seriously kasi there's really nothing inherently wrong with being trial participants, especially kung meron naman ng konting data, enough na data about its possible safety profile, at least in the short term. Then usually also if the vaccine company has a factory in your country, mas mura din usually yung bentahan. So I think this is the case for India and South Korea na magkakaroon ng natutulong sa paggawa ng ibang bakuna. Like I think India for Novavax and like South Korea for, can't remember if it's Sinovac, but because they have the facilities, they have the infrastructure for vaccine production. So yung gagawin nila is kung ano yung sinabi nung hindi ko naman masasabing mother company, pero kung ano yung sinabi ng company, gagayahin lang nila yung parang formula or yung recipe ng paggawa ng vaccine ng mother company. And I think I have a feel, so normally if you produce the vaccine yourself sa countries ninyo, mas magiging mura din yung bentahan, primarily because mas mura yung magiging transport cost kasi locally produced na siya. And I think I have a feeling that this is one of the reasons why the cost of the Pfizer vaccine was said to be cheaper in Belgium. Kasi nga, meron silang factory sa Tours. Kaso, I think, I don't know when was this, kaso nag-leak yung special price na yon ng bakuna sa Belgium. So medyo na-imbiyan na si Pfizer kung bakit sinabi nila sa ibang countries. Because, I mean, of course, if the other countries would hear na ganito lang yung presyo na nakuha, na binigay ng Pfizer sa Belgium, syempre magreklamo rin yung iba na parang, bakit sa amin mas mahal, di ba? And sometimes it's hard for the vaccine companies to explain na kasi ganito, kasi ganyan. So, kaya minsan, meron yung mga talagang yung mga special price na tinatawag with this bakuna, and it doesn't necessarily mean na merong tinatago or merong corruption na nangyayari. Minsan ayaw lang din ng mga vaccine companies ng mas maraming chismis or mas maraming usapan, so they prefer to have the cost, the special price na secret. But yun na nga, but yun na nga, hindi, it doesn't necessarily mean na merong fishy na nangyayari pag sinabing sikreto yung price, or kasi sometimes the companies really prefer yung parang need to know basis lang yung pricing. But I guess we just have to make sure that even if hindi natin ma-publish in public yung actual cost ng pagkuha natin ng mga bakuna, I hope that there is still transparency between the people involved sa negotiation ng prices. So, and then hopefully meron din auditing afterwards para lang yun iwas corruption. But yun na nga, wag masyadong advance mag-isip na pag hindi nyo alam yung presyo, baka merong kumita, merong tumubo. Pwedeng oo, pwede rin hindi. Pero it really depends. But as long as merong transparency between the people na involved sa negotiation and merong auditing na mangyayari, I think we really don't have to worry too much about the possible corruption, at least for now. Okay, so more or less, na-cover na natin yung efficacy ng mga COVID-19 bakuna. Now, let's address the safety concerns naman. Medyo mahaba-habang usapin to actually, pero try kong pasimplihin. I'll try my best. It is important to remember na hindi lang ang COVID-19 vaccine ang unang bakuna na ituturok sa katawan natin kung sakali. And I hope you are aware of this. And I hope you know this, na bata pa lang tayo, nabakunahan na tayo against nabakunahan na tayo ng vaccines for or against mumps, measles, rubella, probably TB for some children, and maybe tetanus toxoid siguro sa iba, even adults. Basta, marami na. And before, many are okay with vaccination. Walang masyadong issue. Except, I think recently, parang dumadami yung mga anti-vaxxers. And some of them have this illogical fear sa bakuna, mainly because of the news that they get from various unreliable sources. Some meron pang mga conspiracy theories na lumalabas. And so these are quite alarming. Pero meron din naman na mga tao na medyo apprehensive lang sa pagpapabakuna for lack of enough information regarding its safety. And I think that the latter one, I think that is understandable. And I think some or probably many of the Pinoys right now are in this category, yung parang apprehensive, pero willing naman na makinig and willing naman na mag-change yung decision if makumbinse na safe enough yung bakuna. And yun, I also hope na nandito yung karamihan sa inyo sa category na to. So unlike the vaccines that we get as babies, na tapos na yung lahat ng phase 1, 2, 3, and 4 ng clinical trials and ilang dekada nang ginagamit for mass vaccination, yung mga bakunang yon. COVID-19 vaccine is special kasi nasa interim phase 3 trial pa lang tayo. So, nasa kalagitnaan pa lang tayo ng, or hindi pa nga kalagitnaan, pero nasa interim phase 3 trial pa lang tayo. And yet, because we are in this special pandemic situation where our lives and our economy are basically put on hold dahil wala pa tayong panlaban kay ating COVID, then kailangan nating mag-decide kung anong risk ba yung iti-take natin. Kumbaga, dahil nga sa urgency ng situation, kailangan nating mag-take ng calculated risk and umpisahan yung pag-administer ng bakuna for emergency use kahit interim phase 3 trial data pa lang yung available. Ideally kasi, kailangan patapusin mo na yung long-term efficacy and safety studies ng phase 3 trials, which lasts it takes about 1 to 2 years yung phase 3, yung complete phase 3 trials, and you usually need this bago mag-start ng mass vaccination. Pero dahil nga sa sitwasyong halos isang taon na tayong nakikipagtaguan kay ating COVID at marami ng businesses yung nalulugi, we need to take these calculated risks. But what do we know so far? In terms of short-term efficacy, short-term safety, medyo may sagot na naman tayo based on the interim trial data. So far, all of the vaccines with interim results are safe in the sense na majority of reported adverse effects were mild to moderate, and this includes pain at injection site, soreness, fever, fatigue, chills, at kung ano-ano pa. There were cases of severe side effects reported sa ibang bakuna, but those were very rare. Less than 1% of the trial participants, and the effects were temporary. So far, no serious and permanent side effects reported naman yung mga bakuna, or at least no serious and permanent side effects that can be attributed to the vaccination. Kung meron man medyo seryoso, like yung mga napabalitang parang Bell's palsy before, those were temporary side effects. There were a few deaths reported, but again, the link to vaccination has not been established. So perhaps those can just be due to coincidence. Kasi, let's face it, may mga namamatay talaga, but it doesn't mean na dahil yun sa bakuna, baka namatay lang talaga siya from other reasons, or baka may sakit siya, or ewan ko. But at least they know na yung mga trial participants na namatay, hindi naman linked sa bakuna. And again, kung meron mang death, it's usually really rare. Yan. When it comes to short to long-term safety and efficacy naman, unfortunately, wala tayong masyadong information kasi yung first na bakuna, yung first na interim first 3 trial data natin ay nagsimula nung mga bandang July 2020 pa lang naman. But one of the main concern, I believe, ng maraming Pinoys ngayon is the possibility na magkaroon ng tinatawag na antibody-dependent enhancement or ADE ang SARS-CoV-2 infection following vaccination. You probably know that. You probably are not familiar. You are not familiar with ADE, but ADE is a phenomenon. Yung antibody-dependent enhancement is a phenomenon that is common and it's known, well studied in dengue virus infection. And so this antibody-dependent enhancement or ADE is a rather complicated process na mahirap i-explain kung walang basic background sa immunology and virology yung tao. But again, itry ko rin i-explain ito into the simplest way possible. So during a typical dengue virus infection, the virus would bind to a receptor on the cell surface that would then facilitate its entry into the cell to initiate rounds of replication leading to production of its progeny virions. So, yung dengue virus, papasok sa cell via the cell receptor. Pag nasa loob na cell, magpaparami siya para makaproduce siya ng maraming anak na virus or progeny virions. Now, if neutralizing antibodies are produced either following natural infection or following vaccination, these neutralizing antibodies, yung parang yung green na to, nakikita niyo dito, these neutralizing antibodies are able to bind to the virus and prevent it from binding to the cell receptor. So, pag na-coat na ng neutralizing antibodies yung dengue virus, hindi na siya makakapag-bind sa receptor. So think of it this way, parang sa SARS-CoV-2, parang yung kung na-coat na neutralizing antibody yung spike protein, hindi na siya makakapag-bind sa ACE2 receptor sa human cells. So parang ganyan. So yun na nga. So hindi once na-coat ng neutralizing antibodies, hindi na siya makakapag-bind and therefore walang infection na mangyayari sa cell. Kasi hindi na siya makakapasok sa cell para mag-infect. Now, sa tinatawag na antibody-dependent enhancement or ADE, merong na-produce na non-neutralizing antibodies during infection or also during vaccination. And these non-neutralizing antibodies, although they are capable of binding sa dengue virus, hindi niya kayang i-block completely yung pag-bind ng virus sa receptor. Instead, yung Fc gamma ng bound antibodies can be recognized by Fc gamma receptors on some cell surface, such as the macrophages, and this binding would actually help the virus infect the cells more efficiently. So again, I'm trying to, because these are technical terms, but yeah. So in this case, instead na ma-block ng infection, instead na yung pag-bind ng antibody, ng non-neutralizing antibody would help block the dengue virus infection, actually, tumulong pa ito para maging mas mapadali ang pag-infect ng virus sa cells. Kasi in addition to just binding to the cell receptor, pwede pa siya, nagkaroon siya ng extra receptor na pwedeng gamitin para makapasok sa cells. Now, I hope that's clear, or maybe you don't really have to know the details, basta merong minsan sa natural infection or sa vaccination, minsan may mga non-neutralizing antibodies na napoproduce, and these non-neutralizing antibodies, instead na makatulong siya sa pag-prevent ng infection, nakakatulong pa siya na mas lalong makapasok yung virus sa cells, and therefore mas magiging malala normally yung manifestation ng disease. Now there is another kind of ABE na gusto, well maybe let's not just talk about it for now. If you have questions, I'm pretty sure may mga taong magtatanong about this ADE kasi ito yung parang sikat na sa dengue vaccine na release sometime 2 or 3 years ago. So we can discuss more about this later. So this ADE phenomenon is known sa dengue virus research way before nagkaroon ng pagbabakuna ng dengue vaccine sa Pilipinas. So, basically, kung alam mo yung mechanism of pathogenesis ng virus mo, you could actually have some idea kung gaano ka-risky yung pagbabakuna. And this is why, usually pagdating sa, pag merong mga reports na merong dengue virus na na-develop, normally, yung experts would automatically ask, meron bang na-observe na possible ADE sa mga trials ninyo? Because the risk for ADE is quite high for dengue virus that walang basta-bastang mag-approve ng mass vaccination against dengue nang hindi nasisigurado na walang possibility for ADE. Because yun na nga, pag may idea ka sa virus mo, more or less, magkaka-idea ka for possibility ng ADE. Now, pagdating sa COVID-19, so far, wala pa namang nare-report na ADE sa SARS-CoV-2. So, in a way, that's good. Although, I should say na ADE has been reported for its kamag-anak virus like SARS and MERS. So, I guess it depends on how you want to think about. So, I can't exactly say na zero risk for ADE, yung SARS-CoV-2. But kung merong ADE na nagaganap sa COVID infection, I would guess na there should at least be papers now saying this. Kasi nga, this is a very interesting phenomenon. So since wala namang nare-report so far, maybe there's no possibility or maybe hindi pa na-discover. But yun na nga, it's not zero risk for ADE, but yung question is it a risk worth taking? Especially given na ang dami na nagtutumbahan sa mundo, na nalulugi na yung ekonomiya, and now we have this emerging new variants of SARS-CoV-2. So, yun, I mean, it's really a risk-benefit kind of decision. Parang hindi siya perfect na decision. There's no safe decision, but you just have to choose kung ano yung better for you and for the world or for the country. Yun. So, unfortunately, yan ang realidad ng sitwasyon natin. Okay, so kung hindi zero safety risk ang pagbabakuna against COVID-19, at least what can we do to minimize this potential safety risks? Well, first you have to talk to your doctor or discuss your specific situation to a medical professional. Kung meron kang known na immune system problem like autoimmunity, you should ask your doctor if vaccination is right for you or which vaccine is best for you. Personally, I would say I would stay away from vaccines that are highly immunogenic kung meron kang parang immune problem sa immune response mo, especially kung hyperactive yung immune response mo. So I would personally stay away from vaccines that are highly immunogenic, such as the modified mRNA vaccines, kasi baka maging OA ang response mo. But I mean, it's just my personal preference. I won't say na, I mean, kasi wala namang basis, to be honest. But yeah, you just have to be careful kung meron kang problema sa immune response mo. You should also inform the medical professionals na mag-administer ng bakuna about your known allergies. Kasi baka merong component ng bakuna na allergic ka. Like yung alum ng inactivated vaccines, some people are allergic to it. Or maybe yung matrix M ng Novavax. I don't know what exactly it is, but maybe they say it's saponin based, but I don't know what it means exactly. Or even the lipid nanoparticles ng mRNA vaccines yung ginagamit sa pag-encapsulate. Some people are allergic to this lipid nanoparticles. So pwedeng bonggang-bongga, sobrang bongga na yung immune response nila na hindi na siya nakakatuwa. So, now, this is not to say na in general, bad for people with any allergy yung mga na-mention ko na bakuna. 98, maybe 99% of the time, okay lang yung mga bakuna natin, even for people na merong konting allergy. Ang problema lang is kung jumakpat ka na meron kang allergy specific to some of the vaccine components pala. So, maybe think of it this way. Kunwari, peanuts yung isang COVID bakuna. Majority of the people in the world would regard peanuts as a harmless food. Actually, masustansya siya, di ba? And masarap pa nga siya. Unfortunately, about 0.6% of the population are severely allergic to peanuts. And then actually the presence of peanuts in their vicinity is enough to cause anaphylactic shock and perhaps cause their death. So parang ganun ang very rare case of adverse reaction against COVID vaccines. So kailangan maging aware tayo. Normally it's not dangerous for many individuals, pero kailangan maging aware tayo kahit papaano kung ano yung component ng COVID vaccine na ituturok sa atin para sigurado na wala tayong allergy against any of its components. And this is one reason why you are asked, yung possible allergic reaction actually, isa sa mga reason why you are asked to stay sa vaccination center 15 to 30 minutes after vaccination para lang siguraduhin na walang serious allergic reaction ang katawan sa bakuna. So, meron namang safety precautions pagdating doon na nakalagay, na parang built-in na sa mga vaccination programs. Also, after mabakunahan ka, you have to monitor your side effects. As I briefly mentioned earlier, yung na-observe na pain sa injection site, soreness of the body, and fever mean na nag-respond yung ating immune system sa tinurok na bakuna sa atin. And you actually want your immune system to respond. So you actually want to have those mild side effects para better yung chances natin na maganda ang ma-develop na protective immunity. But these side effects should be temporary and should normally last up to 72 hours after vaccination. So kung medyo lumala ang pakiramdam and medyo matagal yung nararanasang side effects, make sure you contact the health professionals para mabigyan agad ng karampatang lunas kung kailangan. Okay, so safety pa rin, vaccine safety pa rin to. Let's talk a little about the case of elderly deaths in Norway after Pfizer vaccination. So, sometime in mid-January, nagkalat yung news na meron daw 23 na nagsitumbahan ng mga lolos and lolas of Norway after vaccination with the Pfizer bakuna. Actually, I think umabot ng mga 33 yung count sa news over that particular weekend. So naturally, if nakakabasa ka nga ng mga ganon, magpapanik ka talaga because it somehow implied na nakamamatay yung Pfizer vaccine, or at least yan yung naging conclusion ng iba after reading the news. needless to say, this is a very sad news for Norway because it somehow indicated that that particular vaccine may not be suitable for use sa elderly population nila. And given that the elderly are the ones that need the vaccine the most, since isa sila sa pinaka-vulnerable na group for COVID severe cases or death, this was quite a sad development. But in case hindi kayo aware, yung mga minalas na lolas and lolos of Norway na yon were already in their mid-70s. They were quite frail and they have serious medical problems. So it's quite difficult to know kung ano yung role ng pagbabakuna sa death nila. But after investigation and autopsies, the Norwegian health authorities concluded that there is no direct causal link between their death and vaccination. Meaning, yung bakuna itself is likely not the reason for their deaths. That is, kung wala namang ibang seryosong sakit yung mga matatanda na to, hindi naman sila malamang mamamatay sa pagbabakuna lang. And also, I should say na yung death, yung 23 to 33 death, is quite rare considering at that time mga 40,000 na yung nabakunahan or 33,000 na. Basta very small population but significant pa rin the way na lahat ng mga nagtumbahan ay mga elderly. But of course, then you also have that factor na since matatanda naman sila, maybe without bakuna or not, magtutumbahan naman talaga sila dahil nga may sakit sila at matanda na sila. So ang hirap malaman talaga. Also, whether the vaccination was a contributing factor, medyo mas mahirap din malaman. Not just the direct relationship, but also the indirect relationship. Pwede kasi na yung mga, dahil nga mahihina na yung mga lolas and lolas of Norway na to, hindi nila nakayanan yung supposedly mild side effects lang ng bakuna. But this possibility is, again, quite difficult to know kasi nga, Pfizer vaccine was also tested in some elderly during their phase 3 trials. And so far, medyo wala namang bonggang adverse reaction na nakita. If anything, to be honest, I would even suspect na because of immunosenescence na tinatawag or yung natural na paghina ng immune system natin with aging, yung expectation actually is you get less reactogenicity as you get older. But again, who knows? Kasi nga baka weird na yung immune response ng mga lolas and lolos. So maybe there are reasons kung na pwedeng mag-alleviate yung vaccine, yung pwedeng mag-cause ng bad reaction yung vaccine sa mga elderly population. But who knows? Kasi yung mga elderly trial participants naman sa mga phase 3 trials, usually, well, all of them did not have serious medical conditions. And I will talk a little bit of this in the next slide, I think. Anyway, nagsabi na rin naman yung WHO na walang kailangang ikabahala ang mga lolas and lolas of Norway, and Pfizer vaccine is still considered safe for the elderly. And in Norway, tuloy pa rin naman yung pagbabakuna with Pfizer, BioNTech, and Moderna. So far, meron ng, as of Feb 3, marami na rin ng mga lolas and lolas of Norway ang nabakunahan. But I don't know kung ilan pa yung nadagdag sa number of deaths. Pero I think they have concluded na walang direct causal link yung bakuna and yung death nung mga cases na yun. Okay, so I guess this is more scientific chismis about COVID vaccine and the elderly. So about 2 weeks ago, several countries in the EU, including Germany, Italy, France, Poland, and recently Sweden, Denmark, and Norway, released a statement that they will not use AstraZeneca vaccine for individuals over 65 years old. Again, iba na naman yung, dahil nga sa statement na to, iba na naman yung naging interpretation ng media sa statement ng authorities na to. Basically, yung kumalat na chismis is hindi safe ang AstraZeneca sa mga matatanda. Actually, this is not true. Ang pinaka-accurate na statement at that time would have been walang enough information regarding the efficacy and safety ng AstraZeneca vaccine against the elderly population. And why is this so? Sa clinical trials kasi, you usually try to enroll people of different sex or gender, ethnicity, and age para mas maging representative nga yung data mo. But you usually, during the enrollment stage, you usually exclude individuals with comorbidities and frailty. Mainly, which would include the lolas and lolos, mainly for ethical reasons. Kasi hirap naman na isasabak mo kaagad yung mga weak individuals sa bakuna na hindi pa nga, wala pang masyadong information regarding its safety profile. So yung usual practice is you include these weak individuals sa late stage trials na kung meron ng enough na data to somewhat guarantee their safety, the use of the vaccine sa kanila, safetyness, yun. So for Moderna, Pfizer, and Gamaleya, they were able to get a vaccine efficacy of 86.4 to 100% in their elderly population na part ng trial trial participants. In the case of AstraZeneca, however, late na nilang dinagdag sa trials ang mga lolas and lolos. Actually, I think, as far as I know, mga 660 elderly individuals yung in-enroll ng Astra. Kaso, sa later stage na nung phase 3 trial. And so, walang masyadong data about the frequency of COVID-19 cases in the placebo versus vaccinated group ng elderly ng AstraZeneca trial. And because sobrang baba nung placebo cases, you can't do you cannot make robust statistical analysis sa data na to, and therefore walang data. So this means na it doesn't necessarily mean na hindi effective against older people yung AstraZeneca vaccine. It just means na kailangan ng additional data to conclude kung effective nga and safe nga yung AstraZeneca against the lolas and lolos. And actually, sa phase 3 trial nila, this is a bit, I feel bad for AstraZeneca because in the phase 2 trial, yung AstraZeneca ang isa sa may pinakamaraming mga elderly population na sinama. And based on those, nakita nila na merong, based on like antibody data, merong significant protection naman yung mga lolas and lolos na vaccinated with AstraZeneca. Pero nung ginawa na kasi yung phase 3 trial, they decided na i-include later na sa phase 3 trial yung mga lolas and lolos. So ngayon, wala pang masyadong COVID-19 cases sa placebo and vaccinated group nila. So walang magawang conclusion regarding the safety and efficacy of, actually sa safety, I think they have some data, but yung efficacy, wala. So sa side naman ng sa mga health authorities of EU, dahil nga sa higher mortality risk against COVID-19 ng elderly population, yung mga health authorities, they have to prioritize the vaccination of these elderly population despite limited data on its efficacy and safety. In a way, safety in this age group. So to play it safe, some EU countries decided na yung mga vaccine na meron ng data about meron ng data about the safety and efficacy of their vaccines, yung pwede munang gamitin for the lolas and lolas of the region. And for now, this did not include it did not include AstraZeneca when they made this statement. Kasi nga, because of this. Although, I think just this Friday, AstraZeneca already provided extra data sa mga British regulators showing efficacy and safety data in the elderly, and apparently good naman yung data. So I don't know if later today or sometime this week is payagan na i-reverse na ng EU countries yung decision nila na wag gamitin sa elderly yung Astra bakuna. So I guess we will wait and see. But I hope na hindi agad tayo matakot sa mga ganitong nababasang statements. We have to put everything in context and know exactly kung ang problema kasi minsan we rely on the headlines, and if the headline have this parang medyo clickbait na way ng pagkakasabi, parang and then yun na yung tumatatak sa utak ng tao. Hindi parang mas na enhance yung fear natin sa bakuna sa mga ganitong klaseng chismis na nababasa. So I hope we have to be really careful pagdating sa pagpapaniwala and also pag-intindi ng mga naririnig nating bali-balita online. Okay, so this is just a slide to emphasize the fact that there is currently a shortage of COVID-19 vaccine in the world. As early as July 2020, ang dami ng mga nag-pre-order ng bakuna. And unfortunately, merong mga delays sa vaccine production ng ibang mga vaccine companies. It seems like companies like AstraZeneca and Pfizer will not be able to meet their estimated production, at least this quarter. But they will probably ramp up the production soon. Plus, well, marami na rin namang iba pang promising vaccine na nasa pipeline, and soon magre-release na rin sila ng mga efficacy data nila. But at the moment, we know na kulang ang supply ng COVID bakuna na meron for emergency use. In fact, meron ng decision na i-control muna ng EU ang exports ng mga bakuna nila outside the region. So I don't know what this means exactly. Pero yon, and syempre ang daming mga simpleng awayan between countries na nangyayari because of this access to the vaccine. So I'm just showing you this just so I hope you get, kasi yun na nga, yung iba parang yung nagiging plan B na nila is kung wala na talagang bakuna, tig-isang dose na muna para lang merong partial protection yung lahat. So I hope you get an idea that at this stage, for countries like us na walang sariling COVID vaccine production facilities, medyo mahirap talagang magmaganda. And we really have to learn to make do of the situation and maximize our access to some vaccine by negotiating with companies. Kailangan nating maging mas creative sa ating approach para magkaroon tayo ng bakuna as soon as possible. Well, safe, at least yung as soon as possible, yung mga bakunang safe enough naman based on some interim phase 3 clinical trial data. So yun lang. Oh, okay. So what are the COVID-19 vaccines that the Philippine government plans to order? So I can remember when I got this data, and I'm not sure if this is updated, but basically we plan to get some vaccine from Pfizer, AstraZeneca, Gamaleya, Sinovac, and Novavax, and I think also recently with Moderna. So yun. But more or less, wherever we can get our hands to ng mga vaccine, kukuha tayo. Parang ganun yung approach natin ngayon. And I believe na last January, merong, well, yung clinical trial for Janssen, yung Johnson & Johnson na bakuna, and a bakuna from this company called Clover Pharmaceuticals na from China. They have been approved for clinical trial in the Philippines sometime in January. And recently, pati na rin yung Sinovac, nagkaroon na rin approval for clinical trial. So, magkakaroon na ng access sa tatlong bakuna na ito yung Pilipinas kung magiging trial participants tayo sa late stage clinical trial phase 3. I didn't talk much about the Clover vaccine kasi nga wala pa masyadong information about it, but it's a subunit vaccine, so para siyang Novavax in a way, na protein siya na isasaksak sa tao. It's a spike protein primer, pero instead yung sa Novavax, you have the matrix M as your adjuvant. This one is a CpG as an adjuvant. And I believe yung clinical trial na gagawin sa Pilipinas is phase 2 and 3, the first quarter of 2021. But I hope FDA na-review nila ng maayos yung efficacy profile ng safety profile ng Clover vaccine na to with the whatever Clover vaccine data available for review na binigay sa Philippine FDA. I don't know if I'm making sense. So, so this is just a list. Hindi ko masyado makita, masyado maliit yung ginawa ko. But these are just like the priority groups na magkakaroon ng makakatanggap ng bakuna sa Pilipinas. So, you have the frontline health workers, which is necessary kasi nga lagi silang meron silang high risk for exposure sa COVID-19 na virus. And not just that, hindi lang kasi yung risk na magkasakit yung mga healthcare workers yung problema dito. Well, yung risk na magkasakit sila and bumagsak yung ating healthcare system dahil nawawalan na tayo ng medical professionals is bad. But also, kasi itong mga healthcare professionals na to, they are in constant contact with people na nasa ospital, meaning these are sick people, meaning mas vulnerable sa mga sakit. So they can spread the virus easily kung hindi sila magpapabakuna. Well, higher chance of spreading. I won't say zero chance. Okay, I won't say anything about this one kasi magugulo lang. But anyway, so your priority is frontliners, and then you have the senior citizens, and then indigent senior citizens, and then remaining senior citizens, and then remaining indigent population and uniformed personnel. So, well, I don't know if, well, I do agree with one and two and three so far. Because I mean personally, my if it were up to me, I would prioritize the frontliners and the vulnerable group. The economic situation ng tao, I don't think it matters that much when it comes to priority sa pagbabakuna. I think you should prioritize those people na mas madaling matumba with COVID-19. But I don't know if this is the final priority group. But later I will show you how. So I'm currently, I don't know if you know this, but I'm currently based in Norway, and they have established a priority group, and I should show it to you later. Maybe we can compare the prioritization ng Pilipinas and ng Norway. So anyway, ano pa ba yung gusto kong sabihin? Well, early, during yung nung naglalabasan pa lang yung mga bakuna, early stage ng paglalabasan ng mga results ng bakuna. Ang daming mga usap-usapan, maraming mga Pinoy na disappointed regarding the government's choice of vaccine. Maraming gusto na ganito, kesyo ganyan. But really, we really have to be realistic sa mga goals at ambisyon natin sa buhay. The decision on what vaccine to purchase, it will not just depend on efficacy or yung, kasi yun na nga, sabi ko nga, hindi perfect yung mundo. And we have to consider yung availability, which is, I think ngayon, that's the main determining factor. And also the practicality or the convenience nung pagkakaroon ng bakuna. Kasi nga, like, yung Pfizer and Moderna, they have to be transported in super lamig na condition, and mas mahihirapan tayo doon. And maybe, well, those can probably be used sa mga areas na merong direct international flights or maybe big cities na merong access sa mga biofreezers. But for remote areas, I don't think the modified mRNA vaccines, given yung mga storage condition nila, would be ideal for those. And then also, we have to also consider cost. But really right now, labanan ng availability yung usapan. Because basically, I mean, you've seen the summary table. More or less, karamihan naman sa kanila ay effective enough. It's really just a question on ano yung unang makakarating sa atin na bakuna and ano yung kaya nating mabayaran. Kasi nga yung iba is really expensive. And if you are considering vaccinating at least 70% of the population para maka-achieve ng herd immunity, then you would have to vaccinate 70 million of the population, and that's a lot. And yun na nga. So may mga factors na kailangan nating isa-isip ba? Hindi yung parang gusto natin itong bakuna, gusto natin ganito. Merong mga realidad sa mundo na kailangan ma-realize natin and magising tayo. Okay, isa sa tanong ng mga tao sa mundo ngayon ay kung kailan na ba talaga matatapos tong pandemya. At ang short answer ay matatapos to kung mahihirapan ng makapaghanap si Ateng ng taong mapagpapasahan niya ng virus niya. And therefore, meron tayong tinatawag na konsepto ng herd immunity kung saan sinasabi na kung ang majority ng population ay meron ng protective immunity against a certain pathogen, in this case SARS-CoV-2, then kahit yung mga iba na technically susceptible pa rin talaga sa infection, pwede na silang magkaroon ng indirect na protection by virtue of mas nahihirapan ng matransmit yung virus dahil nga mahihirapan na yung transmission dahil mas marami na yung immune. And as you know by now, herd immunity can be achieved in two ways. Either yung majority ng populasyon ay ma-infect na, or ang majority ng population ay mabakunahan na. And as of last weekend, February 7, meron pa lang 1.4% ng world population ang infected with COVID-19. And I know na 106 million is a lot, pero actually 1.6% pa lang to ng world population. Meaning, meron pang natitirang 98.6% ng populasyon na pwede pang ma-infect ni Ateng. So obviously, the best way to achieve herd immunity is via vaccination. At the current rate of vaccine rollout, it was estimated na mukhang aabutin pa ng 7 years daw bago matapos ang pandemya. And this is based, of course, on yung current rate ng vaccine distribution kasi ang dami-daming delays na nangyayari. And of course, this can easily change then pag mas mapabilis na yung vaccine production and also kung mas marami ng effective bakuna ang nade-develop ng iba't ibang kumpanya. Now, it was initially estimated that we can achieve herd immunity for COVID-19 if around 60 to 70% of the population ng area yung mai-immune. But with the emergence of these new variants, yung mga worrisome variants with higher transmission and therefore higher R0, mukhang higher proportion of immune population na raw ang kailangan para magka-herd immunity. I think yung latest estimate is dapat around 70 to 85% na yung dapat na merong protective immunity para ma-achieve natin yung herd immunity. Okay, so let us briefly talk about these emerging worrisome variants ng SARS-CoV-2. So for those who would like to understand this variants better, I have a separate video with a more detalyadong scientific chismis on SARS-CoV-2 variants. So check nyo na lang yan kung gusto nyo talaga ng mas detalyadong explanation. So sabi nga ni Lolo Fauci, the best way for us to prevent evolution of a virus and the emergence of more worrisome SARS-CoV-2 variants is to vaccinate as many people as fast as we can. You can think of it this way. Since every replication nga ng SARS-CoV-2 sa katawan ng tao is an opportunity for its RNA genome to acquire mutations, the more hawaan ang mangyayari, the more chances ang binibigay mo kay Ateng to reinvent itself and potentially acquire advantageous phenotype like higher transmission, immune evasion, resistance to antiviral drugs, etc. So, yun na nga, kailangan natin ng effective and safe na bakuna ASAP kung gusto natin na ma-minimize yung chances na mas maraming worrisome variants pa ang magsisilabasan in the future. Ngayon, some of the available COVID vaccines have released some data regarding their cross-protection against the new worrisome variants. Please note lang pala that the current vaccines were designed using early variants as vaccine targets. Kasi nga bandang mid-2020 pa nila ginawa yung mga bakunan to, di ba? So wala pang mga worrisome variants nun. And given na sa spike glycoprotein ang karamihan sa mga interesting mutations na nangyayari na nagli-lead dun sa mga worrisome na phenotypes, merong possibility na hindi optimal ang protection na mabibigay ng mga bakuna against the new variants. And also, as I mentioned in the previous slide, this has possible implications sa percentage na needed natin to achieve herd immunity. So here's a table showing the estimated efficacy of some vaccines against the emerging worrisome variants. So merong mga vaccine companies na tsumamba sa choice nila ng country for phase 3 clinical trials. Kaya nagkaroon sila ng information regarding cross-protection of their vaccines against these new variants. Isa sa mga to, yung Novavax, who published their estimated efficacy against the UK and the South Africa variant last week sa peer-reviewed journal, yung BMJ. Ito yung link if you want to check that out. So, kung i-consider ang variant na nag-infect sa trial participants dun sa calculation for efficacy, Novavax estimated na their vaccine was actually 95.6% protective against moderate to severe COVID-19 disease due to infection with the early strains. So kung yung early strains lang ang bibilangin, 95.6% protective daw ang bakuna ng Novavax against moderate to severe COVID disease. Ito yung mga, so these are early variants, yun yung mga SARS-CoV-2 na wala pang worrisome mutations. For UK variant naman, Novavax has 86% protection daw based on their clinical trials sa UK, where 52% of their observed cases has the UK variant. And for South Africa variant, mga 60% daw yung protective, yung cross protection based sa trial nila sa South Africa, where majority of their observed cases has the worrisome South Africa variant. Unfortunately, wala silang trial sa Brazil, so walang information. Now, Sinovac has a Brazil trial. Ito yung medyo sumikat a few weeks ago kasi may mga naglabasan na chismis na sobrang baba nga raw ng efficacy ni Sinovac sa Brazil trial, which was 50.4% against very mild to severe COVID sa mga healthcare workers of Brazil. Now, experts are saying na baka nga isa sa mga explanation na mababang efficacy ni Sinovac sa Brazil is dahil baka yung worrisome Brazil variant na yung dominant SARS-CoV variant sa area. Unfortunately, hindi pa napapublish yung data ni Sinovac, so hindi ko talaga ma-check. Pero baka nga raw, kaya baka isa sa mga reason kaya mababa yung efficacy ng Sinovac sa Brazil is dahil yung variant na kumakalat na doon is yung may bagong mutation. Astra also claimed na yung bakuna nila has comparable protection against the early variant and the UK variant. So that's good. Johnson & Johnson. Yung Johnson & Johnson naman ay meron daw 57% protection against moderate to severe COVID due to the South Africa variant after a single dose vaccination compared to 66% against the earlier strains. Pero yun nga, except for Novavax, based lang sa press release ng mga kumpanya ang mga estimates for efficacy na to. at least for now. So I guess we just have to take their word for it, at least sa ngayon. Wala pang efficacy claim against worrisome variants yung ibang vaccine companies kasi wala silang naging clinical trials sa UK, sa South Africa, or sa Brazil. But I am sure that they are doing neutralization assays experiments ngayon para i-check in vitro yung ability ng mga antibodies from their vaccine trial participants na makapag-neutralize or makapag-inhibit ng infection ng mga bagong worrisome variants na to sa susceptible cells. So they can easily do that in vitro sa lab lang. So para i-check yung mga correlates of protection. So hopefully may publish na rin nila ang mga data nila on this against the worrisome variants soon. So, if you think about it, yung outcome ng pandemya ngayon ay highly dependent on two things. Yung bilis natin na makapag-develop ng highly effective and safe vaccines, as well as yung bilis na rin na i-administer ang mga bakuna na to sa mas maraming tao. Versus yung bilis din ni ating na mag-evolve at magkaroon ng worrisome variants na magiging mas challenging for our existing public health responses. So, dahil nga relatively medyo mas mababa ang cross-protection ng mga existing bakuna against these worrisome variants as you have seen in the previous table, some are saying na baka wala ring point na magpabakuna since partial protection lang naman ang kayang i-provide ng mga available COVID-19 vaccines. Gaya nga ng sinabi ko paulit-ulit, partial protection is always better than zero protection. So for that reason alone, justified pa rin yung pagpapabakuna. Also, kahit hindi pa optimal ang protection na meron, yung mga existing bakuna natin ngayon, the fact na meron na yung design na already tested sa phase 3 trials and medyo proven safe enough naman ito, at least sa majority ng vaccinated individuals so far, mas madali nang mai-improve ng mga vaccine companies ang mga next versions nila ng bakuna para mas gawing mas appropriate sa emerging variants. Kasi hindi na sila start from scratch. In many cases, malamang kailangan lang nilang baguhin ng konti yung sequence against the spike protein vaccine target nila para maswak sa kung ano man ang circulating variants sa area. And they can do that as an extra booster shot lang. Or maybe, baka hindi na nga kailangan ng tweaking nung sequence pa. Baka kailangan lang ng extra booster shots of the same existing vaccines para lang optimized ang protective response ng katawan. I guess it depends. But ang point, we already have promising vaccines right now. Kailangan na lang i-improve ng konti pa, if necessary talaga, depende sa kung ano ang magiging dominating SARS-CoV-2 strains sa lugar at a given time. So, maybe at some point, para na lang flu vaccine ang magiging preventive response natin kay Ateng. Yung tipong ipipredict na lang or di kaya alamin ang dominant variant sa area for that specific time. And yung kumpanya magpuproduce ng version ng COVID-19 vaccine na suitable for the circulating variants sa time na yon. So yes, hindi pa naman bleak ang future natin. Okay, a few other important points bago ko tapusin ang scientific chismisan na to. Future challenges. So as I have mentioned before, the current efficacy data that we have were based on protection against symptomatic COVID. So, yun nga, yung binilang lang usually is kung meron kang mild, moderate, or severe na COVID. Wala yung asymptomatic. So, except for AstraZeneca and some anecdotal info from Pfizer, wala pa talagang nare-release na information regarding the protection of many of these vaccines against asymptomatic infection or yung mga COVID infected, yung mga SARS-CoV-2 infected individuals na walang minamanifest na kahit anumang symptoms. And why do we need to know kung bakit why do we need to know kung pati asymptomatic infection ay kayang i-prevent ng pagbabakuna? Because ang eventual goal natin ay ma-stop or at least makontrol natin ang transmission ni ateng. So since limited pa lang ang current information regarding possible protection from transmission or asymptomatic infection ng mga COVID-19 vaccines, meron pa ring concern na baka pwede pa rin makahawa sa susceptible individuals ang vaccinated individuals kung protection from symptoms but not actual virus protection ang provide ng mga bakuna. So this is something na kailangan malaman natin sa mga existing bakuna soon. But for sure, the current bakuna will limit SARS-CoV-2 transmission naman. Chances are, meron namang effect, malilesen naman yung transmission. Yung question lang is, to which extent? Kasi ideally, gusto natin 100% or zero transmission na talaga. I mean, 100% protection from infection or meaning zero transmission. Para sure na zero yung transmission. But at this point, I hope matuwa pa rin tayo sa mga recent developments na nangyayari sa mundo regarding our fight against COVID-19. Because yung mga science-based developments natin ngayon, from basic scientific studies on SARS-CoV-2 to developing effective treatment and control and preventive strategies against ateng COVID, nasa sobrang unprecedented speed na talaga, na nakaka-amaze actually from a perspective ng someone like me na nasa scientific field. Sobrang bilis talaga, magugulat ka, ma-amaze ka talaga kung gaano kabilis. And yes, it is still not enough. But kahit papano, medyo matuto naman tayong i-appreciate yung mga small victories natin against ateng. Yung fact lang na highly protective against severe COVID, yung mga existing bakuna natin ngayon, ay super good news na yon kung tutuusin. Kasi ibig sabihin na to, less chances na magtutumbahan ang mga vulnerable loved ones natin. Also, less ang chance na magpapa-hospital tayo pag nagka-COVID. So meaning, less hospital bills for countries like Pinas na hindi pa completely libre ang healthcare. So, yun. Makakatipid tayo personally at makakatipid din si PhilHealth kung may bakuna. But I hope matalo na nga natin si ateng sa laban na to soon. And yung future natin actually ay nakadepende sa pagkakaisa rin ng lahat. We all have our respective roles to play. Yung mga scientists natin, yung bahala sa mga masusing pag-aaral kay SARS-CoV-2 at sa paghahanap ng mga epektibong, yun na nga, control, treatment and preventive strategies against ateng COVID. Yung mga medical professionals naman, sila yung bahala sa pagbabakuna, pati na rin sa paggamot sa mga nabiktima ni ateng. And then yung appropriate branches ng government natin ang bahala sa pag-develop, pag-update, at pag-implement ng COVID-related policies and protocols. And finally, yung general public naman natin ay may responsibilidad na may responsibilidad na maging hindi pasaway at sumunod sa kung ano man ang existing rules and regulations na pinapatupad sa area natin. And if possible, include na natin yung pagpapabakuna kung proven safe naman yung vaccine na to for you. And also let us try to, I guess, refrain from spreading unreliable COVID news. Kasi nangyayari kadalasan, tayo din yung nagtatakutan sa mga sarili-sarili natin. So, yun lang. Okay, tapos na ang aking litanya at ang aking scientific chismis. As usual, ingat tayo lahat and good luck sa mundo. Bye! Bow.